Hello, everyone. This is Rebecca Gaydon, Senior Principal of Capital Equipment Solutions at Vizient, introducing this exciting new podcast, The Capital Compass. On The Capital Compass, we help you navigate your journey to value. You'll dive into the most dynamic and surging areas in healthcare spend management, from diagnostic imaging to group eyes and everything in between. Now, stay tuned to enjoy the podcast.
Welcome to The Capital Compass, the podcast that helps you navigate your journey to value. I'm your host today, Adam Fairbourn, and we're continuing our discussion on diagnosing and treating cancer with Theranostics. Joining us again today are the authors of a fascinating article titled Theranostics, A New Weapon Against Cancer. I have with me today Lindsay Williams from Vizient, Setu Shah from SG2, and Janna Laton, a nuclear medicine professional. We're so excited to have them here with us again today. Lindsay, last time we talked a lot about the clinical advancements of Theranostics. So let's pick up our discussion today by considering what it takes for a healthcare organization to implement Theranostics. What are some of the biggest challenges right now?
Yes, it's definitely a heavy lift. One of the biggest challenges for a hospital or cancer center trying to implement Theranostics is understanding the business and the financial side of it. These therapies are expensive, both the radiopharmaceuticals and the infrastructure needed to deliver them safely. Reimbursement guidelines can be complicated and are still evolving, especially as newer therapies come to market. Facilities have to figure out whether they can realistically cover those costs through insurance payments, alternative funding, or institutional support.
I agree, Lindsay. When we think about the financial side, I have the privilege of talking with a lot of our administrative partners and strategy-related teams on the health system side. And those who are trying to enter this space, they're making sure they have the financial support to invest in this, not only from a front-end perspective, but the annual costs that are required in maintaining the costs and the therapies that you've highlighted a little bit earlier.
Are there any success stories that you can share, maybe some institutions that are leading the way in solving for some of the access and workflow issues?
One of the ways we're seeing systems try and organize their financial teams as well as their strategic and clinical teams is creating things such as tumor boards. Tumor boards are actually quite common in cancer care. We see this for things like breast, colorectal. They're ways that a lot of our clinical leaders gather together and discuss cases. And a lot of organizations who are trying to expand in this space and trying to create a centralized approach are developing almost like a centralized radioligand therapy tumor board as a way to better select patients and discuss the right approach in terms of their current treatment as well as their earlier lines of therapy and future lines of therapy as well.
I agree, Setu. And there's several institutions across the country that are leading the way in Theranostics, not just in delivering what's currently approved, but also those that are participating in clinical trials for new applications. What sets these organizations apart is that they're not just focused on the science, they're also tackling the access and workflow challenges head on. They're developing these streamlined care pathways, enhanced coordination between nuclear medicine, oncology, pharmacy, and administrative teams, and creating those models that they can scale as the demand grows. So their work is really laying the foundation for more widespread adoption of Theranostics in the years ahead.
We saw a recent organization talk about some of their top challenges as it relates to implementing Theranostics. 1 being the referral process, 2 being supply issues, and 3 being patient selection. Things that me and Lindsay have described help really get at the referral and patient selection process. The ability to be a sustainable Theranostics program, ensuring that you have a strong pipeline of referrals and as well as strong coordination amongst patients during treatment as well as after treatment.
And I also want to add that I've been very encouraged by the growth and success of Theranostics in the community setting across the United States. It isn't just limited to the large academics. We're seeing remarkable stories from community hospitals and private practices that have really embraced this approach. These stories show that with the right infrastructure, training, and partnerships, community settings can deliver cutting-edge personalized cancer treatment options closer to home.
Well, it's really awesome to hear some of those success stories, and I'm sure a few of those are maybe even highlighted in the article. What kind of education and training programs are needed to support the growing demand for nuclear medicine specialists and technologists?
Well, Adam, that's a topic that's kind of near and dear to me because I used to teach in a nuclear medicine program. And as Theranostics continues to grow, there's a critical need for more trained nuclear medicine technologists and specialists. That starts with strong, well-supported education and training programs. Hospitals and imaging centers across the country are facing major workforce shortages, especially in nuclear medicine. And that's why it's so important for those educational programs to actively integrate into their local communities, not only to give students valuable exposure to those experienced professionals, but also to help those facilities meet their pipeline and staffing needs. It's a mutually beneficial relationship when the students get to have their hands-on training and the healthcare organizations gain access to that future workforce that's already familiar with their teams. And those partnerships are essential if we want to build a sustainable, high-quality workforce that can support the growing demand for theranostics.
It definitely sounds like there's a big need for collaboration, joint training, interdisciplinary tumor boards. But looking ahead, your article mentions that the field is projected to grow rapidly. What's driving that growth?
Yeah, Adam, we heard in today's episode, as well as the previous episode, the innovation, the expansion, both in hospital systems, but as well into community sites is going to drive a lot of this. It's going to be that increased adoption by different players in the market, traditional health systems, as well as community sites and non-acute players. The Society of Nuclear Medicine and Molecular Imaging has a clinical centers of excellence program, and it has a range of institutions, clinical centers of excellence, comprehensive, as well as registered centers of excellence. And about 22% of those are non-hospitals. But we can expect that number to grow from a community perspective, but we can also expect to see more health systems also have a role. So we'll see increased adoption. We'll also see additional clinical conditions, expanded indications. We heard from Lindsay and Janna earlier that we can expect these to see earlier in lines of therapy. And with the most recent approval for prostate cancer, now patients no longer need to fail a round of chemo prior to receiving theranostics and radiopharmaceutical therapy. We also heard from the innovation side that we'll see expanded applications in new tumor types like glioblastoma. The development of alpha emitters and growing use of theranostics in combination with other therapies will also contribute to this continued growth. On the diagnostic side, we have PET, SPECT, and CT also, which will contribute to sort of the diagnostic imaging side of the growth, as these will remain essential for disease identification, staging, treatment guidance, and response monitoring with SPECT, offering the ability to confirm drug delivery and target engagement more precisely. For detailed forecast numbers, you can check out our article, which will have each of these projections at a modality level.
So theranostics is not just theoretical anymore. It's working in real patients as standard of care, and clinical trials are showing real results, and that is turning heads in the medical community. And on top of that, the technology has matured. We now have better imaging, more precise targeted materials, and radiopharmaceuticals that can be manufactured and delivered more reliably. Combine that with FDA approvals and growing interest from pharma companies, and you have a field that is suddenly moving very fast.
Absolutely. And one of the biggest drivers is that there's a rising demand for this cancer care. We're seeing an increase in cancer rates across many populations. As people live longer, the likelihood of developing cancer goes up. So that's just creating a need for more precise, targeted treatment options that can be better tolerated by those aging patients. And Theranostics offers a way to personalize that therapy and minimize side effects, which is incredibly valuable in this context. From a public health and a patient care perspective, the demand is only going to continue to grow.
As a nuclear medicine technologist myself, I'm excited about the future of theranostics and everything we've talked about today and what's included in the article that you all authored. What I want to know from each of you is, what are you most excited about when it comes to theranostics over the next 5 to 10 years?
What excites me most about the next 5 to 10 years is the potential to truly personalize cancer care on a molecular level. I'm especially thrilled about the expanding use of novel alpha-emitting radiopharmaceuticals like actinium-225, which could offer options for cancers that have been historically tough to treat. Ultimately, it's about transforming cancer care from a terminal diagnosis into more of a manageable condition.
I agree, Janna, absolutely. And I think what excites me is the potential to dramatically expand access and as a result, improve patient outcomes. Right now, many patients are still having to travel long distances or may not be even aware that these therapies exist. As the infrastructure gets built out and more community and regional centers adopt this, we just have a real opportunity to make these treatments more accessible, not just in these academic hubs, but everywhere. And with earlier diagnosis and more personalized therapies, we're not just talking about longer survival, we're talking about better quality of life during treatment. That's the kind of progress that really matters to patients and families.
I'm excited about watching health systems formulate a better structure around Theranostics. I get to have the privilege of talking with a lot of our administrative leaders, and they're really excited about the space once they have an understanding of the clinical component. And I'm excited to see how they will change, adapt, and grow their clinical structure, their operational structure to help meet this demand, also expand access to patients.
With that being said, do you all envision a future where Theranostics becomes the standard of care for more types of cancer than we see today?
I absolutely think so. I think we're headed in that direction pretty quickly. Right now, Theranostics is already becoming a standard of care option in prostate and neuroendocrine tumors. But as we continue to identify more tumor-specific targets, develop new radiopharmaceuticals, and improve access, I see Theranostics becoming a core part of the standard cancer toolkit, which could be right along chemotherapy, surgery, and immunotherapy. It's not a question of if anymore, but when and how fast.
Well, I love the discussion of the future of where Theranostics is going, the excitement around it for our health systems and patients. But before we go, for any patients, families, or even providers listening, what should they know about accessing theranostic treatments today? And what final message would you all like to leave us with about the future of cancer care and Theranostics?
Nuclear medicine is stepping into a role it has never had before as a core, indispensable part of cancer care. For decades, nuclear medicine kind of lived behind the scenes. It was something most patients had never really heard of, and when they did, it often sounded scary or unfamiliar. And now that's changing. With Theranostics, nuclear medicine is no longer just about the diagnosis, it's directly saving lives. It's becoming a frontline tool in the fight against cancer, offering precision treatments that deliver hope where few options once existed. And we're entering a new era where no complete cancer care team will exist without nuclear medicine specialists at the table. And the future of cancer care isn't coming, it's already here. And nuclear medicine is leading the way. Janna, what are your thoughts?
Theranostics represents a powerful shift in how we approach cancer. It's not just about killing cancer, it's about doing it smarter, safer, and more personally. It's still evolving, but the potential is enormous. And for many patients, it's already changing their lives.
This is all super exciting for patients and the healthcare organizations that Vizient serves. Lindsay, what is Vizient doing on this front?
We already have a robust radiopharmaceutical offering for our members with our distributors and also some manufacturers. We partner closely with your team on the capital imaging side to offer the latest advancements in technology as well. We're just gaining momentum. So as our members continue to grow, we're staying at the forefront of this movement. We're going to be leading the way, and we're going to be right beside them as they continue to grow.
Well, hey, this has been such a fascinating and fun conversation. A huge thank you to our guests for helping us better understand the promise and potential of Theranostics. And to you, our viewers, please like us and subscribe. If you'd like to read the full article on Theranostics, use the link in the show notes to access it. I'm your host, Adam Fairbourn, and thanks again for joining the Capital Compass.